It's best to coordinate IV tubing changes with solution changes when possible. Prepare your patient for a solution and tubing change by explaining the purpose of the procedure and discussing what's expected of her. Prepare the solution at least 1 hour in advance, or if the pharmacy prepares the solution, make sure it's been delivered to the patient care unit. If the solution has been refrigerated, allow it to reach room temperature. Examine the label to make sure you have the correct solution and that it's properly labeled, including an expiration date. Be sure to follow the necessary restrictions if the solution is light sensitive. Open the new infusion set and connect any add-on pieces, such as filters and extension tubing. Keep the protective covers on the infusion spike and distal adapter. Secure all connections.
I'm going to take a look at your IV.
Check the IV site for redness, swelling, or discomfort.
Is it bothering you at all?
No.
Put on clean gloves and make sure the patient's IV cannula hub is visible. If it's not, remove the IV dressing. Don't remove the tape that secures the cannula to the skin. Hang the solution bag on the IV pole. If you're preparing new tubing for an existing continuous infusion, move the roller clamp on the new tubing to the off position. Use the electronic infusion device, known as an EID, or roller clamp to slow the rate at which the fluid is infusing through the old tubing. Set it to the keep vein open rate. Place the insertion spike of the new tubing into the solution container. Compress and release the drip chamber on the new tubing, filling it 1/3 to 1/2 full. Tap the IV tubing to remove air bubbles. Slowly open the roller clamp, removing the protective cap from the distal end if necessary. Prime the new tubing with solution. Then stop the infusion by closing the clamp and putting the protective cap back on the distal end of the tubing. Place the end of the adapter near the patient's IV site. If you're using an electronic infusion device or EID, pause it. Turn the roller clamp on the old tubing to the off position and remove it from the IV access device. Then insert the new tubing into the IV access device. If you need to prepare tubing with an extension set or saline lock, use sterile technique to connect the new injection cap to the new extension set or tubing if necessary. Insert a syringe containing 3 to 5 milliliters of saline. Inject the solution through the cap into the extension set. Now, re-establish the infusion. Gently disconnect the old tubing from the extension tubing or from the IV catheter hub. Apply gentle pressure above the IV catheter hub to prevent leakage of blood from the catheter. Quickly insert the adapter of the new tubing or saline lock into the extension tubing connection or IV catheter hub.
The new infusion now.
For a continuous infusion, use the roller clamp or EID to regulate the drip rate. Affix tape or a label pre-printed with the date and time of the tubing change to the tubing below the drip chamber.
Okay.
Loop the tubing and secure it to the patient's arm with tape.
How does everything feel?
It feels fine.
All right, I'm just going to get all this old tubing out of your way.
Be sure to remove and discard the old IV tubing. If necessary, apply a new dressing at the IV site. Finally, remove and dispose of your used gloves and perform hand hygiene.
Hi, my name's Kayla. I'll be the nurse that's taking care of you. How are you doing?
Good.
Alrighty, it's time for us to change out your IV fluid, so I'm going to get started on that. First, I
Okay.
need to log into the computer.
Identify the patient and explain what you're going to do.
I need to scan your armband. And can you verify your first and last name for me?
Mahesh Jiva,
All right, and your date of birth?
January 13th, 1962.
To change the IV solution without changing the tubing, Begin by collecting the necessary equipment. Check the solution as shown earlier in this video. You'll change the solution when the level drops to about 50 milliliters in the neck of the container. Perform hand hygiene. Close the roller clamp on the existing tubing to stop the flow of solution. To prepare the new solution, hang the IV bag on the pole. If you're changing a glass bottle, remove the metal cap as well as the metal and rubber discs. Take the old container down off the IV pole, holding it with the tubing port facing up. Quickly remove the spike from the old container. Remove the protective cover from the new IV bag and, without touching the spike tip, insert the spike into the new container. Check the tubing for air bubbles. If any bubbles have formed, remove them by closing the roller clamp, stretching the tubing downward, and tapping it. The bubbles in the fluid will rise into the drip chamber.
How's your IV feeling right now?
Okay.
All right. Just gonna flick out some of these air bubbles.
Make sure the drip chamber is 1/3 to 1/2 full. If it's more than half full, pinch off the tubing below the chamber and invert the IV container. Squeeze and release the chamber. Turn the container upright and let go of the tubing. Regulate the flow rate with the roller clamp or EID.
Restarted it. How does it feel?
Okay.
Feels okay? All right, yeah, it still looks great. Can I get you anything right now?
I'm good.
Okay, if you change your mind, this red button right here is the call light. You can just press that and somebody will be in to help you out shortly, okay?
Okay.
Alrighty, I'll be back to check on you in just a few minutes, okay?
Document the addition of new fluids or change in existing fluids in the Medication Administration Record, MAR, or IV fluid flow sheet as directed by agency policy. Frequency of tubing changes depends on the type of fluids administered, additives, and use of blood products. Follow agency policy and requirements to determine frequency of tubing changes.